Welcome to the Abnormal Psychology video lecture about schizophrenia. Schizophrenia is the most severe form of mental illness, and it is what people think of usually when they hear stigmatizing words like crazy or psycho. The diagnosis itself has been around for a long time, but an awareness of it didn't really start until the media picked up on stories like of John Nash from A Beautiful Mind. Schizophrenia includes symptoms of hallucinations, delusions, disorganized speech, disorganized and catatonic behavior, and negative symptoms like a flat affect or social withdrawal. It affects just under 1% of the population, beginning in adolescence or early adulthood. The symptoms seem to be greater in men than in women, but women have a better long-term outcome. As to what causes schizophrenia, researchers are still unclear. There has been research to prove that there are genetic factors, which means that if you have a relative with schizophrenia, your risk factors are higher. Other causes could be related to prenatal exposure to the flu virus, early nutritional deficiencies, maternal stress, and perinatal birth complications, all of these things impacting baby's developing brain. Another cause could be drug-induced psychosis, which means that drugs changed your brain chemistry, which brought on the symptoms of schizophrenia. As for treatment, schizophrenia is considered a chronic disorder, which means a person could have a long-term treatment or institutionalization with this disorder. Studies show that a person who is taking medication and actively participating in the treatment have a better chance of recovery. One of the problems with the early treatments of schizophrenia is that the medications that they used to use had a lot of negative side effects. One of these negative side effects is called tardive dyskinesia, and some of their symptoms include an uncontrollable facial grimacing, finger movement that you can't control, jaw swinging, and repetitive chewing on your tongue or your tongue just thrusting out. One thing that's been shown to really help someone with schizophrenia is family therapy and family support. Many times people with this disorder have already burned their bridges with family members, primarily because nobody understood what was going on. Once families and loved ones begin to understand the illness, then they can be very helpful in helping a person with schizophrenia manage it.